Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callander.
We are blessed beyond imagination today to have this gentleman, a buddy of mine, classmate at Notre Dame. I'm just going to read a little bit about his background. He's from Memphis, Tennessee. Went to Manassas High School. When we were at Notre Dame, I was studying biology. He was studying electrical engineering. Graduated. While he was at Notre Dame, he was a finalist in the Olympics qualification in track. He was a 100 meter, 200 meter athlete, brilliant. I think he went to the finals for the Olympics and had a cramp or something and couldn't continue, but he was a very, very gifted athlete as well. After Notre Dame, he went to MIT and studied information systems and research there. I think there's something else I'm missing, but he might have gone to law school as well.
No, my wife went to law school.
Oh, your wife went to law school. Okay, good. Man, I got that straight. He went to Meharry Medical College, and he is a recently retired laser ophthalmologist. And he invited me about 25 years ago to come down to Memphis to have my eyes done. I was too scared to go. But if I would trust anybody with my eyes, it would be him.
Okay.
So and he's only a couple of years older than me, so he fits in our group perfectly. Okay. And so I'll give you William C. Hurd. Oh, I forgot. He's a brilliant saxophonist. We played in the Magnificent Seven. At Notre Dame, we were a soul band.
Yep.
And we also played some jazz. He had a quintet. I was part of that at Notre Dame. While he was at MIT, he visited Notre Dame for the Collegiate Jazz Festival as a saxophonist as well. And he's recorded plenty of times and still performs. He's a true Renaissance man. So here you are, William C. Hurd from Memphis.
Thank you, John. Thank you, John. Appreciate all of it. I'm glad to be here. First of all, Dr. Callander, you're well known. I took the time to research you and look at all of your accomplishments, and they're impressive. John called me and asked me to do this, and my first thought was to talk about, I did a lot of mission work when I was in my practice all over Africa, and mostly West Africa, and the last 2 trips were in Madagascar. So I have a memoir that I just completed entitled Memphis to Madagascar, a memoir. And I just completed it, and Notre Dame is possibly going to publish it for me. But anyway, after I thought about it, this is a transplant support group. I thought maybe I would talk about, I did quite a bit of corneal transplants when I was in practice. And I thought that might be more interesting. And if anyone has any questions about my mission trips, I can answer those. But I'll just talk about. And by the way, you left out a couple of things that I'm kind of proud of. One is that I don't mean to pat myself on the back or toot my own horn, but I still hold the Notre Dame records for the 100 meters and 200 meters after 50 years.
Wow.
And thank you. And there was another award that I was very proud of, and it had a lot to do with my mission work, and that was the NCAA Silver Anniversary Award, which they give every year to 5 student athletes who were All-Americans in their sport from 25 years before. So I graduated from Notre Dame in 1969. So in 1994, I got the award, and the awardees were Kareem Abdul-Jabbar, Calvin Hill, Grant Hill's father, Lee Evans, the Olympic champion, Jim Ryan, the distance runner, and I'm leaving somebody out, Leroy Keys from Purdue. So that one of the awards that I'm very proud of. Anyway, so let's get back to. So I brought a model of the eye. So what I'm going to talk about just briefly is what we do in corneal transplantation, because there's a lot of myths. You know, a lot of patients would ask me, somebody would come in with, say, advanced glaucoma, and they say, well, Dr. Hurd, why don't you just transplant me an eye? Well, it doesn't work like that, you know. It's like asking somebody who's paraplegic to, you know, give me a new leg, because the eye is hooked up to the brain via the optic nerve, and we have no way of replacing nerve tissue right now. We haven't gotten that far, but, you know, there's a lot of research going on. Anyway, so this would be the optic nerve here, and inside the eye would be kind of a messed up model here. So this is a model of the eye here, kind of a, let's do it this way. So when a person donates their organs, the eyes are included. And so so here's the eye. The eye is covered with a tissue called the sclera. And on top of the sclera, you can see the attachments for the muscles that give the eye direction and move in certain directions. And then what covers that is the conjunctiva, where if you get a conjunctivitis, that part of the tissue is affected. So now, the part of the eye that we implant is the cornea, this part right here, the part that you put a contact lens on top of. And so if you remove this here and this is the cornea. This is the part that we transplant. So when a patient dies and donates their organs, what's harvested is that they'll cut out this portion right here, and they'll test it, make sure that the patient has no previous, systemic disease, like infections that might get to the eye tissues. They look at the cornea under the microscope and make sure it has the proper number of endothelial cells, because if it's below a certain minimum, then that's not good tissue. So the tissue comes from an eye bank. So a person dies, donates their organs, and the donated eyes go to an eye bank. And every major city has an eye bank. And it wasn't always like that. We have one in Memphis, but before we had one in Memphis, we had to get one from some other nearby larger city. So, and we had to wait on the tissue to get ready. Now, unlike a lot of other transplantations, as you probably know, Dr. Callander, for example, in a kidney or a heart, you have to be, the blood has to match or something has to match. But with the eye, it's a little different, because this tissue doesn't have any blood vessels in it. So you don't have to worry about matching the blood type or whatever. All you got to worry about is it viable tissue? Does it have enough endothelial cells? Is it clear under the microscope? And so it's preserved for up to like 10 days and in some kind of preservative. And so it's usually readily available. Now, conditions that warrant a corneal transplant or anything that might opacify this surface, because all of your vision has to come through this cornea. All your vision has to come through the cornea. And once it gets through the cornea, once the light image gets through the cornea, it's got to go through this lens here. This is a biconvex lens. It's shaped about the size of a little button in reality. So this is what turns into a cataract. So as we get older, people my age and above, et cetera, John's age, this turns into a cataract. This opacifies. And so it's a very simple little operation. I've done tens and thousands of these over my 36-year practice. This has to be removed and replaced by an implant, which we measure preoperatively to get the proper power of it. It's almost like a contact lens that goes inside the eye permanently. And so for a person who is extremely nearsighted or extremely farsighted and has cataract surgery, oftentimes they can come out without having to wear glasses. And that's the beauty of cataract surgery now, modern day cataract surgery. And most of the time it's just a little 10 to 15-minute procedure. We're now starting to use a little laser in it. And by the way, I should have done some research on this. There was a Black female ophthalmologist that died about a couple of years ago, right before the pandemic, who didn't get all of her due diligence. Do you know her name, Dr. Callander? You know who I'm talking about?
Yeah, she's actually a Hunter College graduate.
Oh,
and also she did undergraduate at Howard University.
Okay, what's her name?
And I can't remember her name now, but
Yeah.
she was the first person to actually do the advanced cataract.
Yeah, well, she didn't get her due diligence.
I don't know. She was. Let's put it this way: we knew all about her. Now,
I know you all knew about
who
it.
were from majority institutions probably weren't as aware.
Yes,
but since she went to Hunter College and
right.
she was from Howard, I knew all about her, and
I see. Okay.
We honored her all the time.
Great.
As you mentioned, she's one of a kind. For some reason,
I'm glad to hear that.
It may come to me by the time you finish.
Okay. So anyway, cataract surgery, that's a whole nother issue, but it's a modern day procedure, nothing to be afraid of. If you pass 60 years old and your vision starts to get cloudy and glary and hazy, then you probably got a cataract and it needs to come out. Your insurance will pay for it. They're going to try to sell you on a special type of lens, an intraocular lens to put in. You pay another $1,000 that your insurance company doesn't pay. That will allow you to also read. It's called a multifocal intraocular lens, or IOL. But I would not, and I put in a couple of those, and it's no guarantee. You can't guarantee 100%. I tell the patient, just do what the insurance companies will pay for, and if you have to, you just wear reading glasses. And most people agree with that. But anyway, so let's get back to corneal transplantation. And okay, and I will also kind of mention about glaucoma. Just in passing, glaucoma is when fluid inside of the eye, it's called aqueous humor, not tears, but aqueous humor, is made by some cells that are located in the ciliary complex right here in the corner of the eye. And so that fluid builds up, and it's also drained at the same time. So if that production of the aqueous humor exceeds the way it's drained, then you're going to get an increase in pressure. And it's increase in eye pressure. We call it intraocular pressure, IOP. And if that pressure stays up too long, over say 20 pounds per mercury, 20 millimeters of mercury, Anyway, if it stays above 20, then it starts to destroy the optic nerve. And we can actually, if you look with an ophthalmoscope through the pupil, you can actually see the optic nerve. And actually, the eye is the only organ in the body, only place in the body where you can actually see active nerves and active blood vessels. Therefore, you can make certain diagnoses. One of which you can see diabetic retinopathy, because you can see the leaking blood vessels from the damage done to the small vessels in diabetes. You can also see hypertensive retinopathy. You can see the AV nicking, we call it, where the arterioles cross the venules. It's like we call it a nicking, AV nicking. You can see a lot of things. You can see high cholesterol in the eye. You can see cholesterol plaques in the small vessels. So it's a lot of things you can see just by looking in the eye. And a lot of times, I've made, ophthalmologists in general can make diagnoses. And I've had patients come to me all the time. Oh, my vision is all of a sudden the patient is farsighted. We call it hypermetropia. Then that could be an indication that their glucose is also high. And so they'll come to me and say, I can't see all of a sudden. And so I'll determine that they're hypermetropic or farsighted. And the thing not to do is prescribe glasses, because if the sugar goes back down to normal, then they won't need those glasses. So the thing to do is to send them to the internist and let them manage the diabetes. So anyway, so the glaucoma, if the pressure gets up too high, it can destroy the nerve, and there are no symptoms. And it's more common in Black people. It runs in the family. So we got people walking around with pressures of 30, 35, and they don't even know it, and they have glaucoma. And the only way we can find it is, so we check everybody for glaucoma that comes into the office, especially Black people over 40. We have drops to manage glaucoma. We have one drop in particular called latanoprost, or it's a drop that you use once a day in both eyes. And if that doesn't work, we go to a second drop. That doesn't work, we go to a third drop. So we have patients that on we call it maximum medical therapy. And if those drops don't work, then we have to go to either a laser procedure, or we laser little holes in the corner called the trabecular meshwork, right in the corner of the eye. Under it doesn't really require anesthesia to lower the pressure. And if that doesn't work, we have to do filtering procedures called trabeculectomy, where we actually make openings and allow the fluid to drain out. So that's a whole nother thing. We have a lot of specialties within ophthalmology. We have glaucoma, we have retina, we have pediatric ophthalmology, we have strabismus, where people come in with crossed eyes or eyes out of line. We have oculoplastic, where people come in with bags under their eyes and want them removed. Anyway, so so that's glaucoma. So Now, the reason that I did a lot of corneal transplants, and I'm not a corneal specialist, I'm a general ophthalmologist. I was a general ophthalmologist, but I was fortunate to have a couple of very, I don't know what the word to use, but kind of took me under his wing, Dr. Ralph Hamilton. He, and actually, he actually has established the Hamilton Eye Institute here in Memphis, a very well-respected institute. But he's since passed away. But when I was a resident, and by the way, I was the first Black resident at the University of Tennessee ophthalmology program in 1981. And they still only have had about 2 or 3. Anyway, and they made it rough for me. They made it rough for me. There were people that didn't want me there. There were people not used to having a Black doctor with the same credentials that they had, and the patients, the Black patients at the big city hospital were thrilled to see me because the white doctors didn't spend time with them, blah, 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 it's the whole scenario. I mean, I'm sure you're familiar with that. And that's a whole nother topic for discussion. So anyway, what was I talking about? Residency. Yes. So Dr. Hamilton would call me and say, "Come, Bill, come and sit with me and sit on this case with me. So I would, at every opportunity as a resident, if he calls, I would just go in and sit in on surgery with him. And I learned a lot of stuff. I learned a ton of stuff without doing a fellowship. And I felt comfortable doing these procedures. I mean, I could have referred them out, but I was comfortable enough with my own self. And so I did tons of corneal transplants, and with great success, I might add. Getting back to some of the conditions that cause that the person would need a corneal transplant for. Okay, injury to the eye, anything that would scar up this cornea. I saw a lot of people who sleep in their contact lenses who develop corneal ulcers. And so I get on their case every time I get a chance and give these kind of talks. So if you're out there wearing contact lenses, stop sleeping in them. You can get a corneal transplant. You can get a corneal ulcer, and if it's right in the center, obviously you won't be able to see through that. So what happens is I have to. So here's what we do. And this is done very meticulously with certain instruments. We carve out a circle on the cornea, on the donor tissue, and we set it aside, and then we carve out a slightly smaller circle on the recipient, on the patient's eye. Patient is either put to sleep or the eye is localized. Usually we do these asleep because we put the patient to sleep because we don't want a whole lot of movement. And then, so we put that tissue, the donor tissue, right on top of the removed diseased tissue. And then we sew it in with the real tiny sutures. It's called tenonylon. It's the smallest kind of sutures that we have in medicine. And we do this under a microscope. And so you put in 4 cardinal sutures. You put in one here at 12 o'clock, 6 o'clock, 3 o'clock, and 9 o'clock. And then you sew in about four about 4 places on each quadrant. And that's kind of a very quick and rude way of saying it, but that's corneal transplantation. And it works. And it works most of the time. And the patient has to be put on steroid eye drops to after the surgery for a certain amount of weeks or months to help it heal. Other things that cause corneal opacities, other than corneal ulcers, there's something called corneal dystrophy, which is something that's probably genetic and probably also something that runs in the family. I see a question about, do you work on macular degeneration? I'll answer that in a second. Corneal dystrophies also sometimes we have different levels of corneal transplantation as well. Some that don't require a whole, what we call a penetrating keratoplasty. Penetrating keratoplasty. That means penetrating means the whole tissue has to be replaced. Sometimes it's just the cornea is this cornea has 5 layers of tissue. The innermost layer is the endothelium. That's the one that I was saying. We have to make sure that when we harvest it, there's enough of it. The outer layer is the epithelium, just like in a lot of other tissues. That layer can regenerate itself. The inner layer is the thickest layer. That's called the stromal layer. And that layer, if that's damaged, that needs to be replaced. That you need a PKP, we call it a penetrating keratoplasty. There are a lot of other indications for PKP or corneal transplantation. But I'll stop here and start answering some questions if you have any. There was one about macular degeneration. The macula is a part of the retina that's located right smack in the middle of the retina. Here's the eye. Okay, here's the eye, and so this is the right eye. You notice how the optic nerve is kind of angled a little bit toward the center? Okay. And so here's the right eye, and then here's the left eye. You see that? See how that optic nerve is going toward the center?
Yep.
So it's going to end up at the optic chiasm. It's a very intricate, very complex. The eyes are so interesting. One of the reasons I went into ophthalmology is because of I do have an electrical engineering background, and there's a lot of optics and there's a lot of just interesting stuff in ophthalmology. And there was a guy at Meharry named Dr. Alex Hansen. Sound like you know him.
Oh yeah, he was one of my great teachers.
Whoa!
From the Virgin Islands.
That's St. Thomas.
And I
also have a hospital named after
just recently got the Hansen Award 2 years ago.
Really?
Yeah.
Wow.
They give it to people who have been around for a long time. And
he's the reason I went into ophthalmology.
Yeah, he's
a very, very nice man.
Incredible guy. Brilliant. Genius.
So I was sitting in his office. I was sitting in his office one day. I was a junior at Meharry, and he put an indirect ophthalmoscope on my head, and he had a patient sitting in the room. He said, "Doctor," he said, "Young doctor, look at this." He put a little biconvex lens in my hand, and he put it in such a way that I could see the whole panoscopic view of the retina. And I was just so amazed by that. That sold me. So I ended up declaring that as my specialty. That's what I wanted to do. So I ended up doing an externship down at Bascom Palmer in Miami. I ended up coming back up to Boston and doing an externship at Mass Eye and Ear. And by the way, before I went to Meharry, and this is the little Howard story here. Before I entered Meharry, I was teaching at Tennessee State University in the business department. I was teaching statistics. I was an assistant professor. And I also had a little side thing going on. I was a director of a small business administration office. So I got that job first with the stipulation that I have to be on the faculty at Tennessee State University. So I did that for about 3-4 years before I went to Meharry. But anyway, so I had no intentions of going to medical school while I was doing that. And so when I decided I had some side businesses going on. And a lot of my business people my clients were doctors. And so I would listen to them, talk about their patient care and all this stuff. And I said, man, I probably can do that. And so I decided to apply to medical school. So I applied to Meharry, since I was in Nashville. I applied to Howard. I applied to, and also was interested in going back to Boston to do a bioengineering doctoral program, joint Harvard MIT. So I had been to MIT and I was familiar with Boston, but my wife and I didn't want to go back with all the bad weather, and Boston has horrible winters. So I had an interview at Howard, and there was this elderly retired physician who interviewed me. And he looked on my resume and he said, I see you're a musician. So you're going to have to give that up. You can't be a doctor. You can't do both of these, man. Come on now. And I said to myself, what the, I didn't say it. I was respectful, but I knew that I wasn't going to give my music up. And so I was put on the waiting list at Howard. So that's the whole story. But anyway, but nowadays they look for doctors who have other interests in fine arts. I have a friend who's on the admissions committee here at University of Tennessee. They're looking for, medical school candidates who have other interests other than medicine. So anyway, I didn't mean to get off track. Macular degeneration, again, so it's such a beautiful thing. I mean, I could talk for days about the anatomy of the eye, and and I was telling you that the optic nerve kind of comes at an angle and it hits, and they come together at the optic chiasm, and the chiasm is located right below the pituitary gland. So people who have pituitary tumors, if that tumor is large enough, it's going to hit that optic chiasm, and it's going to cause some very classical visual field defects. It's called a bitemporal hemianopsia, so that your side vision is gone on both sides. It's a beautiful thing, and I've seen a couple of these in my practice. Matter of fact, one of my tennis buddies, now golfing buddies, had this. And if it gets to that point, then you have to have the pituitary gland removed. Anyway, so the optic nerve comes in at an angle. So if you go straight from the center of the eye, looking through the pupil, and go right straight back, you'll hit the macula. Now the macula contains most of the rods and cones. Those are the light sensitive cells in the eye. They're responsible for your color vision and your central vision. So there's a condition. It used to be called senile macular degeneration, SMD, but senile was taken out, and now it's called age-related macular degeneration. There are two types, basically. There's the dry type, which is the less common. There's the wet type macular degeneration. So, and it's usually in people over, I would say, 70. I could be wrong, maybe 60 or 70. It does tend to, there's a small genetic component, I think. But anyway, it can mess with, it can destroy your vision, and your central vision especially. And the only caveat here is that it once it gets a certain level, like 2200 or 2400, it usually doesn't get any worse. But it's treatable. Wet type macular degeneration is treatable with a drug called Avastin, or it's a vaso. It's a drug that keeps new blood vessels from forming, because those new blood vessels will leak, and they're more fragile. And so if you keep those vessels from growing, it started out as a cancer drug. And so they found the effect of it, and it does work. So it is effective in macular degeneration. But we're still working on drugs that will help dry AMD, but for now we don't have anything. Okay, any questions?
I think John Buchanan identified Patricia Bath as the ophthalmologist that you referred to earlier.
Yes, that's her. That's her. Bath.
Patricia Bath. Yeah. Yeah, who was a legend, and
I bet she was.
She's a legend for us, and
wow.
I think we've been honored to have someone who has the expertise that you have to tell us about the eye. That's an organ that
yes.
is not so well understood by people outside of
yes.
ophthalmology.
Yes.
And you treated it as though it was your son or daughter. You know it so well.
Yeah.
And it's a delight to hear from someone who is so humble and so distinguished in so many different fields.
Well, thank
An
you.
athlete, a musician. What year did you finish Meharry?
1980.
Okay, I finished in 63.
Whoa.
And this is my 60th year reunion that I'm going to this afternoon, as a matter of fact.
Oh, wow.
Yeah.
That's right. That's right.
Yeah, so, but anyway, it's been such a delight. I have one of my recent years of surgery actually had several corneal transplants, because he had the condition that is associated with the commonest reason for corneal transplant is what's the condition called when your eye gets to the point that you have to have a corneal transplant.
Cataract? Is it cataract?
No, cataract.
No, that's the lenticular. No, but he had one of the commonest causes of, in which you get a corneal transplant.
Mm-hmm.
It saved his vision, and he's a surgeon now.
Good.
And
good.
So
good.
So his story is one that, and of course, my best friend in Howard was actually Bob Copeland, who was the chairman of ophthalmology, and he did many corneal transplants as you did. And maybe you can tell us a little bit about, since you have so much expertise, tell us about some of your trips to Africa, and what you did when you went to Africa and did the eye surgeries over there.
Sure. The last two trips were very gratifying. All the trips were gratifying. To go places where you really need it, where there's no. I went to places where they had not, they're not only they didn't have ophthalmologists, they don't have doctors. So I'll talk about Madagascar, because that's the last two places that I went. There were Madagascar is a very beautiful, large island off the southeast coast of Africa. It's on the other side of the Indian Ocean. It's considered an African country. It's a mixture of people with Polynesian, Indonesian. The people have skin like you and me. They got straight hair. It's a very poor country. And there were only 2 ophthalmologists in this whole in the whole country. When I got the award with Kareem and Lee Evans was living there, and when at the award ceremony in San Antonio, he said, "Well, Bill, why don't you bring a team down to Madagascar?" I said, "Okay, well, let me look into it." So we did, and we started. When I said we, there were 2 other doctors, not ophthalmologists, in Memphis that I had gone on previous trips to West Africa with, Dr. Lawrence Madlock and Dr. Steve Cole. Steve Cole is an allergist. Lawrence Madlock is from Wesleyan in Baylor Medical School, a very brilliant guy who is well read, just knows everything. But anyway, so the 3 of us packed our bags, but before that, we prepared, because to get through some of these African countries, it's a lot of corrupt government. There's a lot of corruption, and it's something you have to deal with. I mean, we did it every time we did it. We had to face, customs, trying to get stuff through customs, and so there's a lady named Shirley Barnes, who was the ambassador to Madagascar. And so we got in touch with her, Black lady. And so she helped us. We filled up a container. We got donations from the VA hospital here. We got donations from drug companies. We filled up this big container. We had it shipped to Madagascar, so that it'll be there by the time we got there. Beautiful thing. And everything went fine. We stayed with her at the U.S. Embassy in Madagascar. Stayed there for 2 weeks. I did tons of cataract surgery. They saw other patients with other health issues. One of the early cases that I did, and I write about this in my book, and as a matter of fact, I start my book off with this statement. There was an elderly Madagascar lady who she had hand motion cataracts. Now, when I say hand motion, that means that the best she could see was this. She couldn't count my fingers. She could only see hand movement. We call that HM, hand motion. That's worse than 2400. That's, anyway. I couldn't do both eyes.
I'm not.
So I had to do one eye because there were so many other patients that needed treatment. So I did cataract surgery on her, and I put a patch on the eye. And the next morning, they wait up, and these patients would come from miles away, so they knew we were coming because everything was prepared for us. And I took the patch off, and she started crying. And I said, "Why are you crying?" She said, I saw my granddaughter for the first time. And so then I started crying. It's that kind of thing that it makes you want to go back and go back and go back. So, I mean, and that's just the tip of the iceberg. I mean, these patients would bring, they're very poor people. They would bring food from their farm, their garden, and give it to us. And we don't want anything. We're here to help, And it's a beautiful thing, man. If you ever get a chance, I would tell all the young doctors, if you ever get a chance to do some mission work.
Yeah, I started off my career in Africa, in West Africa, and
Okay.
in Port Harcourt, Nigeria. So I
Oh,
know
Port Harcourt. Okay.
so I know exactly what you're talking about.
One of my best friends is from Port Harcourt.
Yeah. So,
Tony Womadoo.
yes.
Darryl has a question.
Okay.
Morning, Dr. Hurd.
Hi, Darryl.
Really enjoyed everything that you've had to say. Let's see, I got a whole list of questions, but I'll just do a couple of them so other people can jump in.
Okay.
Did I hear you say that elevated blood sugar levels can increase intraocular pressure?
No. No, I said that elevated blood sugar levels can make you temporarily farsighted.
Okay.
No, the blood sugar has no connection with intraocular pressure. Intraocular pressure, that's glaucoma. Elevated blood sugar is diabetes, and that can be detected looking in the eye. And so that can lead to, diabetes out of control can lead to diabetic retinopathy, which can cause blindness.
Okay. Speaking of retinopathy, hypertension is also a possible
Yes.
cause of retinopathy, right?
That's correct. That's correct. Good
Okay.
question. Yeah.
Could you describe some of the symptoms of retinopathy?
Very similar to diabetic retinopathy. Visually, you might not see anything. You might, so systemically, you're going to probably get the symptoms quicker than you would in the eye. I mean, undiagnosed hypertension is a silent killer. So you might get a stroke or you might get a heart attack before you get the complications, before you get symptoms in the eye, the manifestation. But from hypertensive retinopathy. Good question also.
So people may not know that they have retinopathy. If they have blurred vision, floaters, fluctuating vision, dark or empty areas in the vision, or vision loss, they may have retinopathy and not know it.
Correct. So the key thing is what? Go get a check. Go get regular checks.
Okay.
Be proactive.
Can the normal wearing of contact lenses damage the cornea?
No, not really. No. You need to realize, though, I tell people this all the time, contact lenses is a foreign body. It's not supposed to be on your eye. And if you sleep in your contacts, that's just even worse, because your eyes are closed. You don't need them while you're sleeping. Your eyes are closed, so it's a warm, moist environment conducive for bacterial growth. And that's what happens. I got one very intelligent Black female attorney that slept in her contacts for months. And she was just a stubborn lady. And she came in with a corneal ulcer. And she almost lost her eye. I had to put her on very aggressive antibiotic therapy.
And are you still running and playing the sax?
I'm still playing the sax. Music is my first love. Let's get that clear right now. I ain't giving up music for nobody. I mean, no. When I get through with this session, I'm gonna practice my horn. Look, here, I'll show you my horns here. See my saxophones?
Yeah, my son plays saxophone.
Okay. Well,
yeah, we could actually put a group together with the folks we have on the session right now. French horn, keyboard, vocals.
I've been doing a lot of traveling lately. I'm going to Hilton Head, South Carolina. I'm going to play at a place called the Jazz Corner. I don't know if you've ever been there, and I do that often. I have a friend named Charles Curl, who I met when I was at MIT. And we had a jazz group. We played around Boston. And we stayed in contact ever since. So
Hip Pocket, right?
Hip Pocket, right. Oh, wait, by the way, my music can be Hip Pocket. Return of the Hip actually is another CD that can be seen on Spotify, and a lot of my stuff can be heard on YouTube if you just type in Bill Hurd and jazz, or just type in Bill Hurd, you might get a lot of I have a lot of stuff on YouTube. But I don't run anymore. I play a lot of golf.
Can I ask you, this is a very, very interesting presentation, I'm telling you. I wanted to ask you about your time in the 100-meter.
10-1.
Not bad at all.
10-1, that's from 1968 now.
Okay, and look, my time in the 100-yard
Okay.
was 10-2.
Okay. So when I was in high school at Manassas High School, and Manassas was named after the Battle of Manassas, I think. There's a Manassas, Virginia, isn't it? Anyway, so when I was a senior in high school, I was all set to go to MIT on an academic scholarship, on a full ride. I was a math whiz. And I ran a 9.3 100-yard dash.
Wow.
Which broke Jesse Owens' record.
Mm.
But it was a small meet, it was a triangular meet, and it was all black. Because I grew up in segregated Memphis in the early 60s. We had Manassas was all black. We had all black teachers. We didn't have a track. We didn't have But anyway, I won the state, and I ran a 9.3 100-yard dash. So the track coach from Notre Dame came down to visit, to watch me run, and to recruit me. And so I was recruited by every major college that had a track team. UCLA, Rayford Johnson wrote me a long letter trying to get me to come there. Frank Budd from Villanova wrote me a letter. I went to West Point. At Manassas, we had something similar to ROTC. It was called NDCC, National Defense Cadet Corps. And I was a battalion commander of that, a student lieutenant colonel. So I took a trip to West Point. I got an appointment from our local congressman here. So, but anyway, my heart was set on MIT. But after I ran the 9.3, then I decided to go to Notre Dame because I thought that Notre Dame had a nice mixture of academics and sports. So I went to Notre Dame, and I played football one year at the dismay of my track coach. Errol Parsegian came over to track practice one day and say, Bill Hurd, I'm Errol Parsegian. I said, sir, I know who you are. He said, would you like to be a part of the football team next year? I said, sure. So I played football in 1967. And I played wide receiver under Jim Seymour, who was the All-American wide receiver. And my quarterbacks were Terry Hanratty and Joe Theismann. Anyway, I had a nice career at Notre Dame. And as John pointed out, in the 100-meter finals in Lake Tahoe, U.S. Olympic trials, I finished 5th in the 100 meters at 10-1. And the top 4 people, Jim Hines, Mel Pender, Charlie Green, and Ronnie Ray Smith, ended up going on to win the gold medal in the 4x100 relay. So I missed the gold medal. Not only did I miss going to the Olympics, I missed the gold medal by one man.
Yeah, we know Joe Theismann around here.
Oh yeah, he's not the most gracious guy, but you know, he's got a history. He wasn't the best flag guy at Notre Dame. He's still not the best flag guy around here in Memphis. He lives in Memphis, by the way. He married a girl from here, I think.
Well, maybe he had this injury where he got both legs broken.
Yeah.
Football play.
Yeah. Yeah.
So deservingly so. Okay.
Okay.
Well, I just subscribed to the YouTube channel Bill Hurd at Bill Hurd 1088. It looks like 2 days ago you uploaded That's What Friends Are For.
Yes. That was quick. That was quick.
Well, Darryl's very modest also.
Darryl, it looks like I know you, Darryl.
He's an accomplished keyboardist
Uh-oh.
and vocalist, and he's got plenty of recordings as well.
Well, next time I come and visit you, John, maybe we can all get together, man.
Well, Darryl's in
I'm in-
Chicago.
I'm in Chicago.
Oh, you are? Okay. Well, I go to Notre Dame as a visiting artist every semester. You know Larry Dwyer, John?
Oh yeah, yeah.
He has a jazz
Okay.
class that I play at every semester. And so maybe I can come through Chicago.
Yeah, I'd love to see you.
Yeah. I'll get your information from John.
All right,
That'd be
great.
awesome hookup for real.
My goodness, what haven't you done, Mr. Dr. Hurd?
Now I can tell you, my wife is even more accomplished than me.
Ryanette.
Ryanette. She's a judge. She's a circuit court judge here in Memphis. While I was at Meharry, first of all, she went to Mount Holyoke. Then she went to Harvard while I was at MIT. And then while I was in Meharry, she was teaching at Fisk. Then she went on from Fisk to, when we moved to Memphis, she was on the faculty at University of Memphis. Then she decided to go to law school. She was the first law review editor, first Black. And then she decided to go to be a judge. So now she's a sitting judge. And I have two boys. My oldest boy, Bill Jr., both of them started out at Notre Dame. Bill Jr. ended up graduating from Xavier. He worked in my office actually for 25 years or so, alongside me as an optician. And Ryan finished Notre Dame in 2005 with a double degree in Japanese and computer science. And he's out in LA now doing his dream job as a computer animator and visual effects artist. So he's got credits on a lot of movies. He works for Digital Domain.
Any other questions for Dr. Hurd?
Yes. Good morning. This is Elizabeth. Yes, I have a question.
Hi, Elizabeth.
First of all, Dr. Hurd,
Yes.
I want to thank you, my Southern brother, for sharing your gift, especially the eye. I lived in Memphis, Tennessee. My daughter is on the phone.
Okay.
And she was born in Memphis.
Oh.
But she also had a concern about my granddaughter.
Okay.
About her situation that's going on with some things. Nikki, can you hear me? Can you hear us? Okay. She's on the phone. I'm gonna have her talk to you now, Dr. Hurd. Go ahead, Nikki.
Okay.
Hi, Dr. Hurd. Can you hear me?
Hi, Nikki. I can hear you.
Okay, great. Good morning. So I have an 11-year-old daughter. She'll be 12 in September. And I recently, this week, just took her to her annual eye appointment to the optician.
Okay.
And so she indicated that her eye view, is almost 20/20. Right?
Okay.
She said her eyes look healthy. There's nothing wrong. However, my daughter has acid reflux. And so what she told the doctor is that she notices that it's almost like a rainbow of light that kind of flashes across her eyes. And it will happen in a matter of seconds. Like it won't stay very long.
Yeah.
But when that happens, when that flash of colors happens across her eyes, it is an indication that what generally happens is like a trigger or a domino effect. The light happens, her head hurts, then her acid reflux on her stomach starts hurting.
You know what? That sounds almost like migraines, almost.
Yes, that's exactly what the optician pediatrician said, she said it's some type of ocular migraine. And so, of course, as a mother, I was like, what?
Yeah, well, I would recommend that you go see a neurologist. Take that child to go see a neurologist. Neurologist, Neuro, neurologist. And I think they may even have pediatric neurologists.
Okay.
She's in Memphis?
No, Nick was born in Memphis, but
where's the child right now?
We're in Washington, D.C.
Oh, okay. I don't know anybody up there, but no, ask your pediatrician or whoever, could they refer her to a neurologist? That would be your best bet.
Okay, great.
Yeah.
Anything?
Do you think there's a major cause of a concern?
Well, you know how migraines are, they come and go. The thing you don't want to do is ignore it, though, especially if they increase. It could be, and I'm just saying that that's a preliminary diagnosis. I don't know, just not from not being able to examine the child, but
Okay.
in a child, migraines is probably more unusual, and so I would. It's not life-threatening, but it is of concern. Okay. What do you think, Dr. Callander?
Yeah, I agree with you.
Yeah.
Okay. I will make that appointment ASAP. It generally happens. A couple of years ago, when she was a toddler, she had some issues, and we thought it was lactose, and we found out as time went on, it was acid reflux. So I'm very, very conscious of her diet.
Yes.
And how much acid, like spaghetti sauce and ginger and all that stuff that she intakes. I'm always very conscious of her diet. Yeah. And she is now. She even says, "Hey, mommy, can I have this? I think I can't have this because I just had this."
I got you. Well, give all that information to the neurologist.
So it won't trigger her acid reflux. But okay, I definitely will
give all that information to the neurologist as well about the diet. Give all that information. Okay.
Okay, thank you so much.
Okay, you're welcome.
Dr. Hurd, can you name some of the saxophonists that you like to listen to, like possibly Kirk Whalen or?
Yeah, Kirk Whalen is here in Memphis. I'm on one of his albums, by the way.
Okay.
Into My Soul CD. I'm playing baritone sax.
Okay.
So I'm very good friends with Kirk Whalen. Charles Lloyd is my uncle.
Mm-hmm.
You ever heard of Charles Lloyd?
Yeah. Oh yeah.
Anyway, no, I listened to early this morning. I was listening to Joshua Redman.
Mm-hmm.
I listened to John Coltrane still. I still listen to Bird and Cannonball, the old guys. The newer guys, I listen to people like Eric Alexander. I listen to a lot of smooth jazz people like Everett Harp. I just listen. I listen a lot, and I try to pull some of that stuff and put it in my own vocabulary.
Any other questions for Dr. Hurd?
I have a question, Bill. Tell me about floaters.
Okay.
And because sometimes I think there's insects in the kitchen.
Yeah. I got them too.
Tell me about
floaters. That. Another word for floaters is posterior vitreous detachment. Posterior PVD, posterior vitreous. So posterior meaning in the back of the eye. No, in the back, inside of the eye. Mm-hmm. In the back of inside of the eye, right here. So this whole space is occupied by something called vitreous. And that vitreous is very loosely attached by the hyaloid phase with the retina. And so as we get older, and depending on if the eyeball is larger, if you're very nearsighted, those attachments can come loose. And so what you have is folds in the back part of the vitreous face, and so it's like in the jet. This vitreous is like jelly. It's like clear jelly. So if you look to the left, those photos are gonna go to the left. If you look to the right, it's gonna follow your field of vision. Not to worry. Those are very common. We tend to not to do anything about those because most of the time, most people have good vision. They're just annoying.
Right.
So most of the time you won't notice them. So just leave them alone.
Okay. Thanks a lot.
Any other questions for this eminent ophthalmologist and musician and athlete? Any other questions for him?